Pregnancy is a very exciting time for everyone involved. It is a journey that can be filled with happiness, excitement, and anticipation for the bundle of joy that will grace us with their presence soon. It also poses several health risks for mom throughout the course of the pregnancy. One of those health risks is what we call preeclampsia. If left untreated, it can cause severe mortality and life-threatening conditions for both mother and child. Today I will discuss what preeclampsia is, its risk factors, signs and symptoms, and the importance for early diagnosis and management. Preparing for the arrival of a new baby comes with excitement, but it also comes with concerns. A lot of us know or have known somebody expecting. So understanding preeclampsia is a safe way to ensure a happy pregnancy for all and parties involved. So where we will discuss what preeclampsia is, the signs and symptoms, and the importance of the diagnosis. To begin the exploration of preeclampsia, let's get an explanation of what preeclampsia actually is. Preeclampsia is a condition characterized by high blood pressure and damage to organs affecting pregnant moms, usually around 20 weeks or greater. The consequences of preeclampsia can lead to organ damage or death to mom and or baby. Unfortunately, the cause of preeclampsia is unknown. It's probable that it is the blood pressure that is affecting the placenta that causes the condition. Now that we understand what preeclampsia is, it's crucial that we identify the signs and symptoms that lead to the condition. Recognizing these symptoms, such as high blood pressures, which is usually found during a prenatal visit with the doctor, and things like protein in your urine, retaining water, which results in hands, face, and feet swelling outside of what we would consider normal pregnancy swelling. Headaches that aren't resolved with medication, dark spots in your vision, or blurry vision that's getting worse. Due to the effect that preeclampsia has on your liver, it also will include what we call right upper quadrant pain, right underneath the rib. Understanding the risk factors is also an important part of preeclampsia. Things like a history of high blood pressure, a history of also preeclampsia in a previous pregnancy can increase your risk for developing the condition. Kidney disease, diabetes, and autoimmune disorders such as lupus will also be included in those risk factors. Also things like what we consider advanced maternal age, or anybody over the age of 35 or carrying multiples, will also increase your risk. Also important to understand when we need to seek help during our pregnancy if we are experiencing symptoms like the headache that will not go away, blurry vision, and also if you're experiencing symptoms of a seizure like shaking or twitching, that is a sign for you to seek help from your provider as soon as possible. With a clear understanding of what the signs and symptoms are of preeclampsia, let's discuss how important it is of early diagnosis and management, which are crucial to reducing the potential complications of preeclampsia. Early diagnosis would include routine checkups in prenatal care. Typically, we go to the doctor monthly or every couple months during the beginning of our pregnancy. And then the provider may also identify with additional blood tests and urine samples to help if they suspect that you're heading in that direction. Management of the condition usually include things like medications and lifestyle modifications. The ultimate treatment for preeclampsia, unfortunately, is delivery. It's the only cure that is available. We do not like to deliver early. So they try to keep you pregnant as long as possible before a C-section would be considered the last possible option. Education with preeclampsia, you would typically find in your doctor's office. They usually will give you pamphlets during your pregnancy and papers, or discuss the risk factors, especially if you are in that risk factor category. Also, places like Planned Parenthood and things like that nature usually have resources available for moms who are not necessarily able to see their physicians on a regular basis. Now we can reflect on the information that I presented in this speech about preeclampsia, and having a better awareness of this condition can lead to better outcomes for both mom and baby. In summary, preeclampsia is a serious complication that requires attention and understanding. So I want you guys to remember the things that we went over: the risk factors, obesity, advanced maternal age, over 35, smoking, diabetes, previous high blood pressures, also knowing the risk factors, recognizing the signs and symptoms: headaches, blurry vision, swelling, pain in your right side, things of that nature. And the early diagnosis of making sure that we're going to see our physicians on time, and having management done appropriately. In closing, working together to raise awareness about preeclampsia and making sure that the expectant mother has the resources available to receive timely care. The key to providing education and vigilance is so that we may give the children and the mom better outcomes. Thank you.